Good afternoon, everyone, and welcome to another one of Bahama Health's Doc Talk series. I am Marisha Campbell. I'm the Assistant Manager of the Clinical Care Unit, and I am here to welcome you. On behalf of our Vice President, Mrs. Charlene Rogers, and the Doc Talk committee, and our entire Bahama Health and Family Guardian family, I'd like to welcome you. I'm also encouraging you to invite your friends and family. You can share the link because this is the information that we'd like to share with everyone. We think everyone should be well informed. And also, if you have any questions, anything, any burning things that you wanted to just clarify from your mind, we invite you also to jot those down because we do have a Q&A segment that's later on for any one of our panelists. And so without further delay, again, welcome. And I'd like to invite Ms. Tanya Stirrup. She will introduce our first speaker for this afternoon.
Good afternoon, everyone. Dr. LeVard Roberts was born and raised in Nassau, Bahamas, son to Reverend Leonard and Mauricia Roberts. He is married, to Rudy Ann Negram, a board-certified pediatric hematologist, oncologist, and bone marrow transplant specialist. He obtained his high school education at Queens College before attaining his Bachelor's of Science degree at Acadia University in Wolfville, Nova Scotia. During his tenure in Canada, he served on several societies representing the Bahamas, volunteering with several healthcare facilities, pursuing his passion for healthcare. He went on to the University of the West Indies in Jamaica, obtaining his medical degree with special mention in surgery and psychiatry. Subsequent to serving for several years as a house officer at Princess Margaret Hospital, he went on to New York to specialize in internal medicine with Columbia University with special mentions. It was with Emory University in Atlanta, Georgia. As chief fellow, he obtained subspecialization in nephrology with the American Board of Internal Medicine. With this wealth of accreditation, Dr. Roberts has taken up a post at Oak Tree Medical Center here in Nassau, as well as a staff member at Doctors Hospital. Through his extensive training and experiences, he has proven himself to be a person of impeccable integrity, commendable, compassionate, exceptional competence, and unparalleled professionalism. In addition to a love for medicine, he is an avid swimmer and sports enthusiast with interest in architectural and digital design. Fellow members and guests here today, help me welcome Dr. LeVard to our virtual platform. Dr. LeVard Roberts, the lectern is all yours, or the podium is all yours, the virtual podium. Grab it.
Thank you. Thank you. Welcome, everybody. Thank you for joining Kidney Kindness with Bahama Health. So today, I'm going to share with you basically how do we take care of our kidneys. Okay. So I have no disclosures for today's talk. First, I'm going to jump right into it. So I'm going to briefly discuss a few misconceptions as it relates to kidneys, okay? Certain things I've heard along the way. Doc, I drink water every day. How can I have kidney disease? My urine is clear. I know my kidneys are working fine. I'm making the same amount of urine I always made. How could my kidney function be worse? I've had kidney disease, but what about the next kidney, doc? Every day I'm taking my turmeric, my garlic leaf, my vitamin C, I'm gonna beat this kidney disease. I feel perfectly fine, no pain at all. How could I have kidney disease? Dialysis don't work. Everyone I know on dialysis, they die. Okay. So for the next 15 to 20 minutes, I'm going to break these common misunderstandings as it relates to kidney disease, and then talk a little bit about the background and impact of kidney disease as it relates to us. I'm going to give you a little bit of understanding basic on the structure and function of the kidneys, and we're going to discuss the prevalence and surveillance of kidney disease, how to prevent it. And then we're going to talk about living with kidney disease. So what is the true impact of kidney disease? So taking it from a global perspective, over 800 million people in 2017 were diagnosed with some form of kidney disease. This is 1 in 10 persons. And these are persons we see, the elderly, women, persons with diabetes, hypertension, and the racial minorities, Blacks and Hispanics. Now, if we just look at from 2013 to present, in 2013, kidney disease was, the 19th most common cause of kidney failure. When we look at the expected growth in 2040, it's supposed to be the 5th leading cause. Now let's come a little bit closer to home. Now, these are a few countries just in 2013 where kidney disease was the top 10 cause of death. Now, if we look at the Caribbean, we see the Bahamas was on this list from back then. And with the rise of kidney disease, diabetes, and hypertension, we're expecting these numbers to continue to climb. So we said that there's a high incidence in Blacks and Hispanics, but why are we seeing more and more kidney disease each year? So diabetes is the #1 cause of kidney failure, right? In 2011, 2014, about a quarter of diabetics had some level of kidney disease. And even if we look at the pre-diabetics, about 15% and about 5% in the non-diabetics. Now, hypertension, it was almost 600 million cases of hypertension in 75, and now we're over to 1 billion in 2015. 35% of hypertensive, CKD, or kidney disease, and about 15% of persons with pre-hypertension have some form of kidney disease as well, and only 10% in those who have no hypertension at all. So are kidneys really that important? So let's give a little bit of an anatomy, just put some things in perspective. So if you look at your 2 kidneys that are average the size of your 2 fists, they sit at the back of the rib cage at the bottom, and they filter the blood, and they make urine, and that drains into the bladder where we urinate, empty the bladder. That's just the basic anatomical structure of the kidneys. And we look at the functions, people think kidneys just make urine, but there's a long list of jobs that the kidneys have. It maintains a salt and water balance. It balances the electrolyte and minerals, eliminates the waste products, the medications we take, and every foreign chemical we ingest. And it helps to control the blood pressure. It makes sure the blood count, the red blood cell count, is maintained at appropriate goal, the bone health, the acid balance, and the blood glucose or sugar control. So it's much more than just making urine. Now, if we think about the types of kidney disease, if we look at versus structural and systemic, so structural is more so the piping or the actual drainage of the urine. If there's any blockage at all in the urinary tract, that can put some back pressure and cause some kidney damage. But there's also the systemic conditions, like the chronic medical conditions like diabetes and hypertension that affects the kidneys from a microscopic and medical level. We can also look at it from a microscopic and kidney failure. So when you have blood or protein in your urine, that's the basic filtration unit of the kidney that's damaged. And if this is left unchecked, it can actually go on to kidney failure. And these are the things that will be evaluated when you see your doctor. Now, some people can have inherited forms of kidney disease or acquire some along the way. So you may do everything in your nature to protect yourself, but you can have something that's passed on from generation to generation, like polycystic kidney disease, that puts you at risk for kidney disease. And an acquired form is things we do in our nature, from making our diabetes and hypertension worse. All these things can lead to further kidney damage. And then when we talk about kidney disease, there's a temporal relationship. You have acute damage and then you have chronic damage. So acute damage is more so something that is transient, that actually improves with time typically, but if left unchecked or untreated, it can actually develop to chronic kidney disease. Typically, we see that after 3 months of long-standing kidney damage. Now, how do we prevent our kidneys from getting to these states that we're talking about here? So as we said, high blood pressure and diabetes control is the key, two of the top leading causes for kidney disease. So blood pressure control is key. Now you have different variations in what is the true goal of blood pressure when you individualize each person and their medical conditions and ages. However, generally, if you think the top number being over 140 and the bottom number over 90 as a hypertensive in all guidelines. If you're close to these numbers, you want to look at a low salt or a low sodium diet. Typically, we talk about 2,000 milligrams, and this we can find on the back of information or on Google. Now, exercise. We aim at least for about 4 days of 30 minutes of cardio, something to keep the heart beat increased. That alone would help us to lower our blood pressure and help with the blood pressure control overall. So you want to work closely with your healthcare team to find the right medication regimen that's best for you and your medical conditions. And when we talk about diabetes control now, diabetic diet, it plays key. The plate method now, we talk about half the plate being greens or vegetables, a quarter of the plate being lean meat, and then a quarter of the plate being carbs, specifically diabetic related carbs. Typically in NASA, we tend to do half the plate rice, then the macaroni on top of that, the potato salad on top of that, and the meat on top of that. So if we could just control our portion sizes alone, that would help a lot. And you want to look at your A1C. So that's your diabetic control over the last 3 months. That number, once it's controlled, we know you're giving your kidneys the best shot. And regular follow-up with your eye and feet, because if you have diabetes that is affecting the eye or the feet, the chances are you also have diabetes that is affecting the kidney. So these screening helps clue us into early detection and early intervention. So if you don't have any of these medical conditions, what you should do, make sure follow up annually with your physicians, where they do the annual blood test and urine test. In the blood test, we mainly look at the creatinine, it helps give us an idea of how those kidneys is basically functioning. And that gives us an estimated percentage of kidney function. On the urine, it tells us about the microscopic kidney damage. If there's protein in blood in the urine, exactly how much, because the higher the risk for further kidney damage. And you want to identify, conditions with increased risk, like diabetes, hypertension. There's also heart failure, lupus, sickle cell, and cancer and HIV. If you have family members, particularly first degree, mother, father, or grandparents with kidney disease, there's a higher risk, particularly if they have a genetic component to their kidney disease. So all these things are detected with early screening. So we're on a lot of medications, right? And some medications require more monitoring than others. When we talk about over-the-counter or prescribed medications, particularly want to pay mention to your pain medications, like your Advil, your Motrin, your ibuprofen, Aleve, your Naproxen, your Voltaren, all Cataflap, all those in that group have the risk of causing some kidney damage. And if you already have some kidney impairment, you want to stay away from these type of medications. Antibiotics, they require some adjustments depending on your level of kidney function. Hypertensive medications, depending on if your electrolytes are abnormal or you want to find out which one works best for you. Same thing with gout medication, reflux medication, laxative use, particularly the ones with phosphorus, they all have the potential to cause some sort of kidney damage. If you are someone who are on some immune therapy for cancer, lupus, or something else, or chemotherapy, your kidney function should be monitored closely. Now, doc, I take everything natural. Now, the FDA does not regulate these natural supplements. They don't regulate the dose, the content, or the pureness. So some of these medications you're taking is not the same as the next time you take it. And you'll find some people taking it religiously 3 times a day, and they don't want to take a pill once a day. Now, the thing about the pills is these are regulated to say the specific dose does this specific goal, but we can't regulate that with the natural base. So just to highlight a few, licorice root and wild ginger, they can actually cause direct kidney damage. If you have a history of recurring kidney stones, you would actually want to stay away from taking your vitamin C every day or your rhubarb every day, depending on the kidney stones you may have. If you already have advanced kidney disease, you have to monitor your potassium. And drinking things like noni, turmeric, lemongrass, and garlic leaf can also raise the potassium in your diet and therefore cause some new problems. So how would I know if I have kidney disease? Typically, it's asymptomatic until the late stages of kidney disease. And at the late stages, things you would see lower leg or ankle swelling, some difficulty breathing, blood in the urine, foamy, frothy, or bubbly urine, dark urine. Kidney disease can present with decreased urine output or increased urine, lack of energy, appetite, or itchy skin. All these are some signs of late kidney disease. So I've been diagnosed with kidney disease. What should I do now? So the key things are to know your stage. So we said that we estimate the kidney function based on your creatinine level on those annual blood work. That creatinine level gives us an estimation of a percentage of your kidney function. We call it the eGFR, but you just need to know as the percent of kidney function. Once your kidney function is below 60%, that's when we're talking about somewhat moderate kidney damage that requires close monitoring by a kidney specialist. Most stages, stage 1 and stage 2, can be managed by your primary care physician. The next thing is we want to avoid further injury of our kidneys. So restrictions intensify depending on the stage in kidney disease. So like we said, avoiding that Advil, that ibuprofen when we have advanced kidney disease. When we are hospitalized, things like severe infections or illnesses, they can actually cause more damage to the kidneys and progress our kidneys to failure even faster. And you want to make sure, let your physicians know that if you have kidney disease before they order any tests, because certain contrasts can be actually detrimental to the kidneys, depending on your severity of kidney function. And like we said, we want to control those precipitating medical conditions. All right, get those under control. So anytime you have a lot of protein in the kidney, you should see a kidney specialist. Earlier intervention is better sooner rather than later. Recurrent kidney stones. Now, if you have recurrent kidney stones, that means there's something that's actually predisposing these stones to develop. And there are things we can do with diet or medications to help to lower those risks of kidney stones. At any time that kidney function or that creatinine says your percentage of kidney function is less than 60%, you need to see a kidney specialist and establish care to prevent this from progressing sooner rather than later. Now, the D word. This is a word I can't mention to my patients. The idea of dialysis here in the Bahamas, we're really afraid of it. The thing about dialysis is it's designed more so to bring a bridge to kidney transplant. And kidney transplant gets you back to the life that was promised before the kidney disease. And you actually don't need to be on dialysis before being considered for kidney transplant. Once a kidney function is actually under 20%, you can be referred for kidney transplant evaluation. So going back to these misconceptions, I drink water every day. How can I have kidney disease? Drinking water helps, and it has to be individualized, but it's not the only cause of having kidney disease. Just because the urine is clear, we know that the kidney function is more than just making urine. It's clearing those toxins. It's actually helping to remove waste. So the clearness of the urine doesn't always relate to that aspect. Making the same amount of urine doesn't translate always into the level of kidney function. Now, kidney disease generally means that both kidneys are affected. Once you have those numbers in the system or protein or blood and urine, we know that you have a systemic or medical condition. Now, not saying that turmeric, garlic leaf, and vitamin C are bad, but we have to individualize from person to person. Some people it's okay, some people it's higher risk, some people there's no risk at all, and everything in moderation. Now, you feel fine without any pain, but kidney disease, it tends to present asymptomatic. And when you have symptoms of kidney disease, we're talking very late in disease. Now, the reason why we think dialysis doesn't work is because the decision we make the dialysis for is, although we told we should start dialysis a few months ago, we wait until we're in our sickest state and the body is basically beating down. So if we were to start, at a graduated pace, it tends to have a better outcome. And like we said, end result or the end goal is transplant, trying to get back to the life that we once had. So in summary, the incidence of kidney disease is on the rise, particularly in diabetics and hypertensive. We want to ensure our appropriate annual health visits and follow-ups with our blood pressure checks, our blood and urine testing. It's key in prevention and early intervention. See a kidney specialist if you are diagnosed with blood or protein in your urine, or you have recurrent kidney stones or obstruction, or your kidney function is less than 60%. And you want to work with your healthcare team in avoiding the precipitants of kidney disease and controlling those medical conditions that predispose you to kidney disease. And last thing, I want you to be your own advocate. We're in a day and age where information is readily available. You can look at your results and tell your estimated percent of kidney function, and you can make your own referrals if necessary. So, I got my annual, doc, why we never check my urine? How no protein or blood in my urine? It's time to be your own advocate. So early intervention and prevention is key. Thank you. And references can be available on CREST. I'll be available later for any questions and answers that you may have. Thank you.
Thank you so much, Dr. Roberts. That was a very informative presentation, and I am certainly encouraged to be my own advocate. Don't tell me go on Google, because I could Google everything and I can ask all the questions. But it is important for us to definitely take our own health in hand. And I was particularly in agreement with our Bahamian diet. Like you say, we eat everything all at once, all of the nutrients, all of everything all at once, except, all of the vegetables that we really need. And so thank you again for, the information. It's very useful, and I'm sure that our listeners are appreciative of the knowledge base that you've shared with us today.
Thank you. Thank you.
You're welcome. Okay, and so without further ado, I will now invite Ms. Ranice Miller. She will introduce our second panelist for this afternoon, Ms. Tamika Roberts. Ranice?
Good afternoon, everyone. Tamika Roberts, President of the Bahamas Kidney Association, a nonprofit organization formed for two main purposes: to reduce instances of kidney failure in the Bahamas and to improve lives of persons affected by kidney disease. Being a living donor who donated to her brother in 2018, Tamika has experienced the emotional heaviness of seeing a loved one faced with the challenges of kidney disease and the discomfort it brings. She also has experienced the emotional joy that can happen when there is support from family, friends, physicians, and the community at large when support is given to a person diagnosed with kidney disease. Through her own ordeal, she has become an advocate to bringing awareness to kidney disease and is passionate about this mission. She believes that bringing awareness to this disease and encouraging preventative measures will certainly assist in decreasing the numbers in the Bahamas, but there is much work to do. She also empathizes with those that walk this road and understands the needs and desires of those that may have, so her commitment to bringing assistance to kidney disease patients is steadfast. She is currently head of operations at a digital asset financial institution. She has two children, Nikilio and Brooke, who lives in North Carolina. She enjoys running, traveling, leisure time, and raising awareness to kidney disease. Ladies and gentlemen, Ms. Tamika Roberts.
Thank you. Thank you so much for the introduction. Good afternoon, everyone. I'm going to share a little bit about the Bahamas Kidney Association and the work that we are doing. Okay, the Bahamas Kidney Association, it's a nonprofit organization established in April of 2021. And we function with two main purposes: to improve the lives of persons affected by kidney disease and to reduce the instances of kidney failure in the Bahamas. And so what we are doing to achieve these goals are three main things. We are increasing public awareness. And how we're doing this is every month, the Bahamas Kidney Association, we go into the community, mainly in high traffic areas, where we bring awareness. We provide free blood pressure and glucose testing to the general public for free. In addition to that, this month, what we did to increase our public awareness was we had a visit at the House of Assembly where we provided green ribbons to members of Parliament, just to bring awareness to kidney disease and to kind of heighten the importance of kidney health. We also visited the Senate this month. Again, we wanted to make sure that our leaders, the leaders in the country, the lawmakers, that they are aware of the importance of kidney health and, of course, the rise and the increase of kidney disease in the Bahamas. Also this month, during the month of March, we advertised or we promoted wearing green every Friday. And we would have gotten several companies, corporate companies, to wear green and to have their employees support those that are diagnosed with kidney disease by wearing a green shirt. And we've tried to do this corporate wise. And of course, we have several individuals that would have also wore green in support of kidney disease and those that are affected by it. We have 2 more Fridays left. So please, if you're on the call and you need a shirt or if you have green in your closet, we ask that you would please pull it out and support those that are affected by kidney disease and to bring awareness to kidney disease and the increase that it has on the Bahamas. We also had a fun run walk, and this was this past Saturday, which was supported greatly by the community, and we appreciate those that came out and supported. They ran in their green shirts just to bring awareness again to kidney disease. And this was one of our major fundraisers as well this year. Our other objective is to improve the lives of those affected. What the Bahamas Kidney Association does is we have monthly meetings for our kidney patients, and these meetings are held on Sunday at 4 p.m. And we do this once a month. And these meetings are basically where we bring in medical professionals that specialize in kidney disease or anything kidney related. It doesn't have to be a medical professional, but we also bring in government agencies such as NHI or social services, any government agency or any agency that can help those in the kidney community. And we have found that these have been very helpful. We provide education sessions on healthy diet. Kidney patients, they have to have a special diet. So we have a dietitian come in. We ask our kidney patients to also bring in their lab works. And this is where the dietitian would make the relationship between their diet and their blood works. And these have been very beneficial to those that are in attendance. Of course, we would like to increase the attendance because we feel that once persons are educated in terms of how to manage their health, definitely it will help them in the long run in terms of managing kidney disease. We've also this month given we've given 300 care packages to dialysis patients, and these would have been dropped off earlier in March to the centers to give out to dialysis patients. This month, during our kidney session, we treated our kidney patients to a special session. And this session this month was presented by a pharmacist who shared with the patients about medications that are helpful, that are beneficial to the kidneys, and medications that are harmful. We also treated our kidney patients to a spa So we had a massage therapist that came in and actually gave massages to our kidney patients this month. And then they left with a nice little gift to take home. Additionally, we are also in the schools. We have a peer educators group, high school students that also help us to bring awareness to kidney disease. And they do this by sharing the information with other high school students. We believe to reduce the instances of kidney failure in the Bahamas, we have to definitely train our younger persons how to eat differently, how to take care of their kidneys, and then they could share the message to other young people. And so we have students in our high schools that actually do this. We have had a essay and video competition last year, and that's where we were able to have, or I guess we were able to create the peer educators group because these students were so excited. They came on to volunteer, and we wanted to create a space for them to assist other students and other persons, younger persons, to change their diet and just to look at kidney health in a different way. Our students also would have gone to the Elizabeth Estates Children's Home this month and share with those children kidney health and tips that they can use to prevent kidney disease. Additionally, last year during November, Diabetes World Day, our students would have taken to the streets downtown Rawson Square, where they would have held a poster and a slogan competition. And so all of these things, they're bringing awareness, not only to the general public, but definitely making an impact with their peers and the students locally in the Bahamas. We have an essay competition that is presently going on. The deadline is March 31st. For persons that are interested, you can visit our website. The topic is kidney health in the future, challenges and possibilities. Last year, we had several students from around the Bahamas, all the way down to Acklands, Crooked Island, actually, that would have participated and would have placed. And so we're hoping that we get more persons, more students from the islands to definitely join in and to join the peer educators as we try to reduce the instances of kidney failure in the Bahamas. This is one of our major initiatives, the Bahamas Kidney Association major initiatives that we would have conducted a pilot program last year, September. And we want to continue this program. And this is our medication assistance program where we offer free Neprovite, and we're introducing calcium carbonate to enrolled dialysis patients. And we would have, 30 persons would have actually benefited from the pilot program. And we're hoping to increase this number as we roll this out sometime in April to about 50 persons. And we're hoping that persons would join in and we would be able to provide Neprovite and calcium carbonate. And this is for dialysis patients. We have 3 partnering pharmacies with us presently: Comprehensive Pharmacy, Friendly Pharmacy, and Live Well. And we're hoping to get more pharmacies on board the program with us. And finally, we're just asking the general public at large to please show up this month in a special way for our dialysis patients. We want to show them that we support them. We know that they go on dialysis for 3 times out of a week for 3 to 4 hours a day. And so we just want to show them that we support and we love them and that we're here to help them through this journey. I would just leave one last thing with you. Just one last thing I want to share.
You're broken down and tired of living life on a merry-go-round.
Okay, I'm just sharing.
So living life on the merry-go-round, and you can't find out. But I see it in you, so we gon' walk it out. Ooh, ooh.
Some of them still show up
We gon'
for their
walk it
employers.
out.
They still show up for their spouse. They still show up for their children, for family, and for friends. They still show up at church. So during this month, let us show up for them. Bahamas, let us support. Let us be kind. Let us show love. And let us donate.
Thousand times again.
So if you have any questions, I will be here and available to answer any questions you may have. Thank you so much for your time.
Thank you, Miss Roberts. I almost called you Dr. Roberts. I really appreciate what you're doing for the community. And I really like the fact that you're including not just, the older adults, but you're also including the kids, because that is where, the training begins. If you get them involved from an early age and get them learned about things, then, I believe we do stand a better chance of having improvements in, what we're seeing as it relates to kidney health. So thank you so much for all that you do. Your time, your efforts, and all of your energy and your advocacy for kidney health. And your presentation was very well enjoyed. And so now we will have our Q&A segment. If you have any questions for either of our presenters, this segment will be curated by Ms. Natasha Dillett, followed by the vote of thanks by Aaliyah Adderley.
Hi, good evening, everybody. So I've been charged with facilitating the question and answer segment of this meeting. And so we ask that you please feel free to type any questions that you have in the chat for a response during this segment. And so I do have 2 questions to start us off with. And so the first question that I see here in the chat is, can a person discontinue dialysis if there is a chronic kidney disease? So I don't know who wants to take that question, perhaps Dr. Roberts.
Just want to make sure I understood the question. Basically, if anybody wants to start a dialysis, can they discontinue it?
Correct.
So every patient is their own advocate. There's no way we can force you to continue dialysis. We work with you, not supposed to dictate terms to you. So if you feel like, you want to come off dialysis, or, you had a long life and you just want to spend time with family, that decision to discontinue dialysis is completely your own. There's no hard and fast rule that you have to continue and complete dialysis for the rest of your life.
Okay, so thank you for that answer, Dr. Roberts. And so we have another question. What is the average lifespan post-transplant of kidney?
The lifespan of the person or the kidney itself?
I guess we can go into both.
So if you think about it this way, and everybody is different. Post-transplant, if you have, living kidney donors do much, much better than persons who receive a kidney donor from a deceased patient. So these patients, they can actually live the normal, healthy life where they basically, you can't tell that they have any form of kidney disease. Also, it depends a lot on the person itself, compliance with medications and follow-ups, because, there's different follow-up that the dialysis patient would have to do compared to the person on transplant would have to do. But you can have a long, healthy life as if you didn't have kidney disease once you've gotten a kidney transplant.
Mhm. Okay, thank you for that. Thank you so much. And so, Ms. Roberts, we were wondering if you can share your testimony, just a snippet of your journey regarding the transplant.
Sure. So my brother was diagnosed with kidney disease. That would have been in 2017. And when he was diagnosed, he was 39. And he was in Doctor's Hospital, and I remember us going up there. Of course, my mother was definitely broken up because I didn't tell her until I picked her up that he was actually admitted to Doctor's Hospital. And when we got up there, we met with Dr. DeVoe. Dr. Don DeVoe is his doctor. And when Dr. DeVoe came in, he said that, he has kidney disease. And we were like, no, that's a wrong diagnosis. He doesn't have kidney disease. My brother's 39. He's tall, he's slim. I mean, he walked in, he's healthy. I mean, kidney disease, it can't be. So we, me and my sister-in-law and my mother, we got together and we said, we're taking him for a second opinion because Dr. Voe don't know what he's talking about. And so we did the arrangements. We got tickets, this was on a Saturday. So we got tickets, me and my mom, we drove all the way to Bahamas Air. We got tickets. My sister-in-law, she works for an insurance company. She did all the insurance stuff. We were on the first flight the next morning, Sunday morning, to Cleveland Clinic. And I must say, Dr. DeVoe was more than accommodating. He walked us through. He basically held our hands even while we were in Cleveland Clinic, which was very good and refreshing for us to know that, somebody here was still a part of the management for my brother. And so we went over to Cleveland Clinic, and sure enough, we got the exact same diagnosis that he had kidney failure, both of his kidneys. And so, of course, this was a crisis for my family. My mother has 2 kids, and it was a very emotional time for my family. And so we went through this entire process of him going to Wildwood, a lifestyle changing center, because at the time he was not ready for transplant, and they told us that his body was not able to do a transplant at the time. He went to Wildwood, he got cleaned up. When he was finished with Wildwood, he was ready for transplant, and then within less than a year, my brother had transplant. We went through the whole process of testing my family, my mom, my father. They wanted to be, of course, hypertension and diabetes is so real in the Bahamas, like most everybody has it. So my mom, she has hypertension, she couldn't. My father doesn't, but he had other ailments that he couldn't. My sister-in-law, of course, her husband, she went. She was unable to donate, and then it came to me, the only sister. So I was up next, and so I was the one that went through the process and was able to give him a kidney, which he was on dialysis for less than a year. And of course, this whole process, I mean, I'm speaking it, but it's a very emotional experience, especially when you look at somebody that has 2 kids on an operating table. And I always tell people, even though, donating a kidney, they recommend sharing your spare and doing all that. That is, I certainly advocate for that as well, to do it. But at the end of the day, I would always tell persons to look at their why. Why are they donating a kidney? Because that is so important. Everyone is different. Like Dr. Roberts said, everybody is different. Everyone has a different experience. Not everyone experience would be the same. Your turnout may not be like mine. And so you have to understand and know why you're doing it, because if it doesn't pan out the way you intended, you have to be able to live with that. And when I was contemplating and giving my brother a kidney, I thought about him and his 2 kids. I thought about they're young. My son, he lost his father when he was 13 to cancer. And I thought about, do I want my niece and nephew to go through the same process? Do I want my niece and nephew to see their father being sucked away by kidney disease? And so I didn't want that. And so I was willing to go through the, whatever it was. At the end of the day, if it meant death, you know, so my brother could have another chance. I was at peace with that. I knew my why. I knew what I wanted to do. And so I can say that the morning of the procedure, I think me and my brother were probably the most two that were at peace. Everybody was on edge. You can imagine my mom, she has 2 kids, so she was a mental mess, an emotional mess for the entire time, you know. My father, we had a great support, and that's why I push for families to please support the patients. They cannot do this without that support. It makes it so much difficult if they do not have that family support. Going to dialysis 3 times or 3 to 4 hours, it's rough on the body. And so I encourage persons that have these patients to support them, to love on them. I encourage the community at large to love on them, to please show them your support, because it's so much. And so we went through this process, and I must say, you know, God has been really good. And we could not have done this without God. We could not have, and the support of my family and friends. And so the transplant took place on the 27th of June, 2018. My brother was on dialysis for less than a year. And we are grateful and thankful to God for that. And his team, Dr. DeVoe, I always sing Dr. DeVoe praises, Dr. DeVoe, because he was so supportive, Dr. DeVoe, and his team. And so that was our journey and the process, in a nutshell. I know we're for time, but that was the journey. My healing process was pretty quick. Leading up to this, I would have done some things that differently. I would have come off of red meat. I stopped eating red meat. I don't eat chicken, red meat. I basically eat fish, more of a plant-based diet. And that's just for me and my maintenance in terms of my kidney health. And this is something that I heard Dr. Roberts saying, you go for your annual checks. And this is something we preach to at our kidney sessions. Ask the doctors. This is important to ask. You know, ask the how are my kidneys doing? How is my heart doing? Are they functioning? What are my numbers looking like? Are they normal? And that's something we want to educate the public to ask. It's important. And if you're not getting this from your healthcare provider, find another one. But do not stay there. Do not say, oh, well, my doctor say, I don't know. Find someone that can give you the answers so that you could take ownership of your health. That is so important. And so that is my story in a nutshell and my journey. I don't know if you have questions specifically for me. I'm free to answer.
All right. Thank you so much, Ms. Roberts, for sharing your testimony. We can, I guess, have an appreciation for what you went through, your brother, your family, and that family support that goes a long way. And I guess the sentiments of what has been echoed all throughout, question your doctor, that goes a long, long way. So we really appreciate you sharing your testimony with us, so that we can have an appreciation of what one goes through when they go through that particular process. And so we thank you for that.
You're welcome.
Okay, so I see some other questions in the chat. So if a person has a trace of blood in their urine and was advised to increase water intake, what will help? Or would you suggest visiting a kidney specialist to be certain that the kidneys are functioning properly? So I don't know if Dr. Roberts would like to take that one.
So when we talk about blood in the urine, it's more about the amount of blood too. Everybody, you can have blood in the urine from a simple urinary tract infection, kidney stones, but why we pay attention to it is because some kidney diseases that can lead to kidney failure can present as simple as blood or protein in the urine. And also, some kidney tract cancers can present with blood in the urine. So it's more so about having that early workup to reassure you to say, this is something transient. We've ruled out the concerning things, just continue your follow-up as needed. So we do that investigations, not for the most common causes, but those few common things that can be very detrimental and change your life for the long term.
Okay, thank you for that. Okay, so this question is for Ms. Roberts. So as a living donor, what has been the greatest change made since giving your kidney?
The greatest change would be my diet. There are certain things that I cannot use anymore. So I limit the coffee. They say limit the coffee, and then medications. Some medications I cannot take. And before I actually donated, my team would have reviewed everything that I was on, and then they told me what I can keep, what I could continue to take, and what I can't. And like Dr. Roberts said, we take a lot of this bush medicine and all this other stuff that we cannot measure. And we don't know that these things could possibly be damaging our kidneys. And that was one thing that they also stressed. And so none of that stuff, I take. So I think the diet, none of the energy drinks, all of the Gatorade, the stuff that's high in salt, none of those things I drink or I eat. I limit my potassium intake. At one point, my potassium was very high, so I had to limit. I love foods high in potassium, but this was before I gave up my kidney, so that was my love. And so I had to cut down on a bunch of fruits and vegetables that are high in potassium, and I love those things. And so when mango season comes around, I only can have a little slice, I can't go ahead and eat a whole bucket. And so those types of things I had to change, but that is small in comparison to the type of lifestyle that my brother has right now. And if I had to do it all over again, I would do it all over again, because those things at this point in time, it's a part of who I am and how I live. So it really doesn't matter. But those are the things that I had to change.
Okay, thank you for that. Thank you so much. And so we have another question for you. Okay, so if you don't mind sharing, did you have any post-operative complications?
What happened was during my process, actually, when my brother was diagnosed with his kidney disease, actually, I was just coming back from Cleveland Clinic because I had an abnormal pap smear. And so I went for a second opinion for that. And then I had a stomach discomfort. I didn't know what it was. I didn't know if it was related to my intestines or fibroids. And so I had to do more testing, and all of this is happening simultaneously. And so I had to do more testing, and I was in a lot of pain. And when I found out it was actually my fibroids, I had fibroids. And I told my doctor, because they said, oh, you need to have surgery. But I told them, after I found out I was the donor for my brother, no surgery is going to happen until he gets his kidney. And so I was very strong with that. And so I didn't do anything for my own health in terms of my fibroids or my discomfort at the time until my brother got his kidney. And after that was done, then I was able to deal with the other things that was going on with me. But other than that, I had no other issues in terms of from the transplant. I was able to, I could tell you that night, I had the transplant that morning. And that night the nurse came in the room and she said, Ms. Roberts, she said, it's time to walk. I said, walk? I just came out of surgery. Are you serious?
Wow.
And yes, and she came in and I had to walk, and that was the most painful 5 steps I ever had to make. But of course, they get you up and rolling very fast. I was only in there overnight. The next day I was discharged and I was out. And I was walking ever since, walking long. I'm a long distance runner. So I was back on the road within 6 weeks or less. I was, walking.
That's good.
Mhm.
That's very good. Very good. Thanks for sharing that with us. And so I do have another question. And so I've always been told growing up that too much water can drown your kidneys. So be careful not to drink too much water. And so the question is this a myth of some level or truth? I don't know.
So
Dr.
there
Roberts?
is some level of truth in that we have to do everything in moderation, okay? If you have no medical conditions, drinking to thirst is fine. Or when you're dehydrated in the sun, having a little bit extra. Or if you have an acute, viral illness with some vomiting and diarrhea, increase your water intake for that. But you shouldn't do excessive amounts of water every day, okay? But normal kidneys are actually able to regulate and normalize your salt and water intake depending on how much you drink. Now, in persons with advanced kidney disease or advanced heart failures, the kidneys aren't able to regulate that water and salt the way it should. So it starts to build up even more and more. So you start to get swollen, you start to get short of breath. So that's saying, we have to individualize per patient. As compared to the person with kidney stones, they should drink a lot more water because you want a lot of water flowing to decrease the chances of stone buildup. But generally, with no medical conditions, just drink to thirst and increase when you have increased water losses.
Okay, thank you for that. We have another question. What is the recommended water intake to be taken daily?
So that's it depends on the actual condition. If you don't have any medical conditions, just drink until you're thirsty. But if you have history of kidney stones, you want to drink at least over 2.5 to 3 liters per day. And then if you have kidney or heart disease, you want to limit that to less than 1.5 liters. So it varies from person to person, depending on what conditions you're dealing with.
Okay, thank you for clarifying that. Do we have any other questions in the chat? I don't see any others. Okay, and so thank you so much, Ms. Roberts and Dr. Roberts, for great presentation, and the question and answer period really added to that. And so at this time, I'd like to welcome Ms. Aaliyah Adderley, who will give the vote of thanks. Thank you. Ms. Adderley? I guess we can give her just a few minutes. Ms. Bonamy?
Sure, I'll go ahead. I think Aaliyah may be having some technical difficulties on her end. So with that being said, I'd like to go ahead and thank both of our presenters for doing such an awesome job. As we know, end-stage renal disease is something I almost feel as though that's a little epidemic happening in itself within our Bahamian community. And we're seeing that the ages are getting younger and younger. And so we appreciate Dr. Roberts and both Ms. Roberts for all of your educational endeavors that you have done within our community in itself and the service that you both provide. And we look forward to continuing to spread that knowledge and education among our society so that we all can live improved lifestyles, and kind of help our community along with ridding such a disease that, when people hear about dialysis is always something daunting, especially for myself, having my father and grandmother dying of end-stage renal disease. So this is something that is very dear to me, and I really appreciate your efforts. So I would like to extend my gratitude, as well as the gratitude of my entire Bahama Health team, my VP who is on, Ms. Rogers, I don't know if you want to give a quick hi, a wave, who's also on as well, and our family guardian team at large. We thank you so much. And of course, to our viewing audience, it's always a pleasure to have you join us on an evening through the week. And we look forward to having you again next month, same time for our Docs Talk. Have a wonderful evening.
Good evening, everyone.
Thank you. Thank you.